In Ayurveda, the three gunas of manas are sattva, raja and tama. We are familiar with these terms?
Yeah.
Sattvic, rajasic, tamasic. Let me translate it vaguely into understandable terms. The sattvic state of mind, if you consider this as the normal energetic state of mind, there is a rajasic state of mind which is a state of anxiety or passion or hyperactivity. Then there is a tamasic state of mind which is inertia, which is lethargy, which is laziness. So mind exists in these three states: sattvika, rajasika and tamasika. Thoughts, food and sanskaras influences our state of mind in either of these three states. This can be treated with a combination of medications, counseling, combination of both, through shodhana at times. Sometimes it would have been a vicious circle created by ill health, creating depression worsening ill health. So this becomes a cycle. We have to powerfully break it somewhere. Of course, there are treatment. There is a whole section in Ayurveda treating the psychological conditions, psychiatric conditions. Again, let us be very unbiased about the fact that there are possibilities, there are limitations. There are some conditions which we cannot treat, and acharyas themselves have classified these as pratyakshaya, which cannot be treated. So, when we can't treat, we can't treat. When we can treat, we can try. When we can do better than conventional management, do it. When we can avoid the side effects of the allopathic medicines which are stronger than the effects of the disease, it is worth giving a try this way. So there are various options. Mixing and matching has to be done, individually.
Good evening, doctor. Sir, I'll just give you one example. Like for malaria, a general physician, along with the malaria tablet, had suggested Live Fit, which has made up of Bringraj and all that. So for some other disease, when we asked them that why don't you suggest some Ayurvedic stuff, he said that they are not there, the pharmaceuticals are not making them. For example, fibroids, uterine bleeding, they suggest Esilate tea. Whereas for the same thing, Lodra Asam works very well. Many people, many individual like Art of Living and all, they are giving Shala ke Guglu for your arthritis and all that. So my question is, why is it Ayurvedic doctors asking the pharmaceuticals to make say Lodra Asam capsule or to make a Shala ki Gugl, etc.?
Very relevant question here. Like what is happening to the allopathic systems, it has become a pharma-driven science. If the Western pharmacies are pushing some molecule or medicine, that becomes a standard method of practice. But unfortunately, that is also happening here, but something worse. The Ayurvedic medicine pharmaceutical industries are very keen and very bent upon coming out with products which need not go to a doctor. Products which can be advertised and sold directly. This is a very, very unfortunate thing happening in Ayurvedic system. Everyone sees big money in marketing and selling it directly to the consumer, sidelining the entire, healthcare expertise which the Ayurveda acharyas, should have been prescribed.
So how do we bring Ayurvedic medicines to the allopathic doctors or to the pharmaceuticals?
See, principally it is difficult because I have seen many times, sometimes there is seamless integration. We refer to the allopathic physician and they take over the case very smoothly, and there is a referral from there to here, and we, can smoothly, take over the treatment. There are many examples. But again, as I said, as we are lacking some statistical relevance in case studies, it may take some time. But today's scenario, most of the medicines are available, which are probably sufficient to run a proper practice. If not Lodha, there is something very similar. If not Lodhasava, it can be something equivalent to that. Today's the number of PCOD cases, polycystic ovarian disease condition cases, are about so many cases. You can't imagine. This condition in ladies has no effective treatment rather than giving anti-hyperglycemics in allopathic system. But in Ayurveda we don't use any of it. But again in say ultrasound scanning we can see the cysts have been resolved over a period of 5 to 6.
And all that. So why can't we have capsules which can be like?
See, that may not be possible in all cases. I will tell you why. Sometimes it has to disintegrate fast. Sometimes we cannot turn everything into a capsule. As you mentioned, Lodhasava, that has self-generated alcohol in it. The medicine, the extract of the herbs are fermented in a very contained process, which translates into faster absorption. Alcohol gets absorbed into the bloodstream as fast as probably an injection. So there are definite advantages. We cannot take out the alcohol part of it and give the herb in a water-soluble extract, which may take a long time to act or get absorbed into the system. So there are some reasons why some things are in the form of powder, some things are in the form of paste, some things are in the form of pill. Sometimes, Himalaya Drug Company came out with Jelly-4, which was tablet version of Chyawanprash. Okay? As a doctor, I felt if someone has to get the benefits of Chyawanprash from this Jelly-4, he has to take 10 tablets 3-4 times a day. which is crazy. So some things there are limited. Chyawanprash has to be taken as Chyawanprash. So there are reasons behind it. These are known as Vaishajya Kalpana, pharmaceuticals in Ayurveda, which is a big stream in itself.
And self-life is also a point in this. Self-life is also a point.
Yeah, shelf life is one major aspect. Vehicle is one major aspect. So there are many things which needs to be considered before something unpalatable is made to be swallowed.
Oh dear brother, so I want you to explain or discuss some of the common diseases and their possible remedies that we can make use from the herbs
Yes.
themselves. So we need not go
Can you
to the medicine to the shops to buy. That we produce these herbs in and around us. And how can we make use of these medicines
we
to
can
have a perfect cure for our diseases, the common diseases?
see, for example,
And their dosage.
yes.
Dosage more important.
So
We take tulsi leaves, but we do not know
How many?
how many and how many times and how many leaves we have to take. We do not know. Nobody says that.
I'll just touch upon this chilies aspect.
Just 5 or 6 diseases you just explained, and their possible
See,
remedies.
for example, chilies and ginger. These are the two equivalents which I can take an example of. Chilies are less digestive and more irritant. Ginger is less irritant and more digestive. So naturally our inclination is towards ginger, which is more digestive, less irritant. Chilies, red chilies especially, in North Karnataka and Andhra belt, where the consumption of red chilies is so high, half of the cancer patients in Kidwa Institute in Bangalore are from North Karnataka. This habit of eating chilies after chilies after chilies, it can create gastric inflammation and irritation eternally. So coming to home remedies, as you would want it to be, can you come up with any general condition like that which I can explain?
Cough and cold.
Sinusitis.
Sinusitis.
High pressure.
Pressure and diabetes.
Initial case of osteoarthritis.
Pains.
See, osteoarthritis, diabetes, cough and cold. You can also touch upon diarrhea. See, common conditions like vomiting. We'll start from common conditions like food poisoning and vomiting. The first thing is to fast a little. Don't go by time. It's 2 o'clock, it's my lunchtime, eat. No, wait for hunger to set in. Going by time is good, but going by hunger is better. When we train our body to, coincide the time and hunger patterns, that is the most healthy aspect. The food should be digested. The previous meal what we take should be digested by the time we take the next meal.
Okay.
How do we know it is digested? We get a clear burp, we get hunger, we get thirsty, we are feeling a little light, then timely evacuation of bowel and urine. So there are some signs which shows the food is digested. Udgara shuddhir utsaho vedotsarga yathochitaha laghuta kshut pipasa cha jirna aharasya lakshana. These are some of the signs and symptoms of proper digestion of food. So what happens nowadays? Okay, I'll just touch upon the acidity and vomiting aspect. See, in case of someone is vomiting, they are naturally dehydrated. The best thing that can be given is dark pani with some tal mishri, which will make up for a number of electrolytes. Dark pani with tal mishri. Then if there is pre-existing acidity, lot of secretions in the abdomen which is leading to regurgitation. Khoi? It's known as laja in Ayurveda, or khoi. It can be roasted. It is very, very hygroscopic. It absorbs a lot of moisture. Once you roast it on the kadai, it loses its moisture and becomes absolutely dry. A little pepper powder, a little salt and a little ghee can be mixed when it is roasted on the kadai, so that it loses the moisture, and a thin film of ghee can prevent the absorption of moisture again. This when taken, it acts like a magic that the vomiting sensation, the nausea, everything settles down. Because whatever is secreted inside is being absorbed by it and it is pushed downwards instead of pushing it upwards. Khoi, which is a home remedy. What's the difference between khoi and mudi? Mudi has a lot of salt in it. Khoi does not have salt. Salt can aggravate vomiting. Khoi will not aggravate vomiting. So this is one simple home remedy. Second one is dark pani with tal mishri. This can be given for dehydration. This can be given when someone is vomiting or having diarrheal phase or sweating a lot because of the excess heat. So there is a simple combination of dark pani with tal mishri, palm candy. This is one aspect. Then for simple coughs and colds, a combination of tulsi ras with ginger and honey can be taken. So
Quantity of tulsi?
see, it can be 2 teaspoons each. 2 teaspoons of tulsi, half a teaspoon of ginger, 2 teaspoons of honey. They can be mixed and taken. It becomes one of the best cough syrups which doesn't make you drowsy.
How many times?
Twice or thrice. See, there are number of times which the medicines have to be taken. Aushadha sevana kala. This is known as aushadha. For any respiratory conditions and cough, it is known as mubur. Again and again we have to keep taking it in small doses maybe. For some conditions like neurological conditions, we can take it early in the morning and by evening. It's like that. But for cough and cold, it has to be given regularly.
Too much
And diabetes?
Diabetes, be physically active, mentally stress-free. Our mind is supposed to be calm and tranquil. The body is supposed to be exerting, being busy and walk. It is designed to walk about 30 kilometers a day. Yeah. The body has to be active and mind has to be calm. And we very cleverly reverse the roles of